Max and Austin here from the Overhead Athletic Institute. Today we're going to go through an elbow extension self-mobilization. So today we're going to look at his elbow extension and then I'm going to give him a self-mobilization. And this is a great self-mobilization that you can give to your athletes coming out of surgical protocols, or even athletes who've lost a little bit of their terminal elbow extension as a result of repeatedly throwing, which is something we see fairly commonly in our high school and college aged athletes and professionals. So I'll assess his left arm, and you can see he actually gets a little bit of hyperextension here. And I'm holding down his humerus here. I'm grabbing under his distal forearm, and I'm just lifting him up. And you can get a little bit of extra extension there beyond zero, which is not uncommon. On the other side, you can see we don't get that. So it's much more rigid, and it's got a little bit of a firm capsular end feel. So from there, what we're going to do is give him a self-mobilization where he can work on it on his own, so that when he's not in therapy, he can be reinforcing the range of motion that we've gained through our corrective exercise and through our mobilization. All right, so here's our self-mobilization. This is one of our favorites. We got a bat here. This is actually Ed Martell's bat they gave him when he was with the Yankees, and it looks like he hit a bunch of rocks with it. He was a pitcher. So what we do is we just take a towel for a little padding. The bat is going to be placed against the posterior part, or the back of his humerus bone on the distal part. So he's down just above that olecranon, or just above the tip of the elbow. That's going to allow him to do a little glide forward, a little ventral glide when he does it. So he'll come to a table, something that's fixed, something that's he can either pull up on or push down on, and he's going to turn his body a little this way. And I'll talk about that here in a second, but basically what he's going to do is he can either compress, and sometimes compression helps, and sometimes distraction helps. So he can pull up and hold on and lift, or, like I said, press. If he has a pinch, it gets rid of the pinch or the discomfort the most as he goes through this self-mobilization. So here, he wants to make sure that's positioned above the tip of his elbow, because that's going to be rather uncomfortable. And then, whether he's compressing or distracting at that elbow joint, he's going to do some force this way on the bat against his belly, which then uses leverage and pushes his arm this way, but also it glides the humerus out of that little hook there of the olecranon. So it glides the humerus forward and then either compresses or distracts at the elbow joint. And he can do a static hold, or he can do little tiny oscillations. Now, he doesn't want to go through a lot of pain here, but keep in mind that when he does it, he's actually rotated this way. So when you're doing this at home, or when you're prescribing this to your patients, you want to make sure that your athlete isn't rotated back. So show him what it's like to rotate this way. Now, if he pushes on that bat, he's actually providing some valgus force. So he's providing some UCL testing almost in an extended elbow position, which isn't what we want to do with this mob. We want to create a little clearance in the joint, rather than potentially in a thrower, when they've had some osteophytic adaptations in an older thrower, there may be some more impingement or posterior impingement in that elbow. So play around with it, find the area where it feels most comfortable, and make sure you're not giving yourself a valgus strain on that UCL or on that medial elbow. So oscillating it, some people prefer the oscillation because it feels sometimes a little better. The static stretch is good too, and then he can actually incorporate some contract relax. So he could incorporate a little bicep curl while he's doing it, but not let himself move. So he doesn't let his elbow bend, but he's actively contracting here, relax, and try to go a little farther. He can try to actively extend his tricep, which is a great way to increase the extension there at the end of the mobilization. There's a lot of things you can do here, but you got to find what works with your patient and find what's most comfortable, and make sure that you're not doing a force that could potentially stress, because we use this all the time for our post Tommy John, post UCL repair, those type of patients, ulnar nerve transposition, osteophyte removals, and the most important thing is making sure the mobilization is safe and they understand why they're doing things and how it can be performed. So we always like to grab a model and show them on an elbow model, or even show them on a computer animation of what the elbow anatomy is first. But great mobilization, couple times a day, nothing too stressful, and that'll reinforce what you're doing in therapy. So if you like this video, please subscribe. If you like Austin, give us a thumbs up. If you think he's ugly or something, let us know in the comments section. All right, see you in the next video, guys.